Case study time! Okay, so the first case study is from the Journal of Medical Case Report in 2021, how delay management of atrial lead dislodgement after placed in a pacemaker can actually lead to many complications.
Okay, but what's a pacemaker?
That's a very good question. So a pacemaker is a small medical device that is implanted in your chest where it helps to send out electrical impulses to your heart chambers. And it's usually indicated for somebody who is bradycardic, right? Somebody with less than 50 beats per minute. And it's usually somebody who has either a second or a third degree AV block, junctional or idioventricular rhythm. We won't get too much into details, but essentially what's happening is that your heart is not contracting enough to send out enough blood throughout your entire body. Therefore, you need a pacemaker to help send out those electrical impulses so your heart can contract and become a better pump. Now, some of these pacemakers can send out electrical impulses to different chambers in your heart, right? So you have a single chamber pacemaker where it sends that electrical impulse to either your right atrium or your right ventricle. If you have a dual chamber pacemakers, it sends an electrical impulse to your right atrium and your right ventricle. And then finally, there's biventricular pacemakers, and that's when it sends electrical impulses to 3 different places, right? It sends to your right atrium and both of your ventricles. And again, these electrical impulses are sent through different leads, and we'll talk a little bit more about that. So now let's focus on our patient. So here we have an 83-year-old Chinese woman who has been complaining about shortness of breath for the past 7 years. She had a history of sinus bradycardic, and she also has an episode of sinus rest in the past. She finally had a dual chamber pacemaker insertion with no complications whatsoever. No pain, no signs of symptom, nothing. 3 months later, she had a follow-up pacemaker interrogation, and what they found was that one of her leads was dislodged, right? So in order for these pacemakers to work, these leads needs to be implanted in the right spot. In her case, there was an atrial lead dislodgement. And so, as a result, the cardiologist suggests to the patient that they immediately fix that atrial lead dislodgement. But the patient refused, and therefore she went against medical advice. So 1 year later,
Wait, how did she survive 1 year later?
That's a very good question. I don't know if she survived for 1 year later. But 1 year later, she was having even worse symptoms than the last time that she showed up in the hospital. She was complaining about increased amount of shortness of breath, like even walking just 10 feet, right? Like from point A to point B, kind of like where we're standing right now. Like just walking to that table was enough to knock her out. So she came back to the hospital. And so her cardiologist admitted her down to the cath lab. They want to take a little bit closer look at her heart, right? So she went under for a coronary angiography procedure where they essentially make an incision on her femoral arteries and thread a catheter in to take a closer look at her coronary arteries. And they found nothing. It was a clean artery, right? There was no signs of stenosis or blockage. Her atrial lead was still dislodged, but she had the audacity to basically didn't want to get that fixed. So they medically managed her with some Lasix and she was discharged home. So a few months later, she was readmitted back into the hospital because she continued to have this severe dyspnea, right? It was actually a lot worse than the second time that she showed up. They took her vital signs. They found that her temperature was 36.2 Celsius. Her heart rate was 66, irregular. Blood pressure was 105/80. Her respiratory rate was 22. She was satting pretty well. She was 98% on room air. She did show some signs of jugular vein distension, but it wasn't that bad. Her pulses were fine, nothing out of the ordinary. They did do an echocardiogram on her, and they did find that both her mitral valve and her tricuspid valve were regurgitating from all the fluid buildup in her chambers of her heart. And remember how her BNP was 900 since the second time that she showed up? This time, it was 3 times more. It was 4,200 ng per mil. That's a lot! So homegirl was like, you know what, doc? Okay, you're right. I think we need to fix this pacemaker lead because, if I just keep coming back here and having this shortness of breath all the time, this is not a quality type of living. So the doc was like, thank God. So she finally went under to the table and they fixed her lead. They found that it was actually lodged in her superior vena cava and got it back to where it needs to be. So when we look at her EKG, we can see the before and after the interventions. The before, what we see is that her pacemaker wasn't sensing and it wasn't capturing as well, meaning that it wasn't sending the adequate electrical impulses to essentially cause her atrium to contract. But now we look at the after the interventions, we can see that every P wave that gets the electrical impulses causes an intrinsic ventricular contraction. So her heart was essentially beating a lot better than it was. And there you have it. Wow, cardiology's cool!